I'm Mike Griggs. At the last board meeting, Amy Buckingham was speaking, and Supervisor Williams asked her about ambulance service. And she told him at that time there were 2 ambulances available, one only 3 miles away. Oh, this is about Joan Davis's death a couple weeks ago. I know Supervisor Williams knows more about ambulances now than he did at the time of the meeting, but I wanted to clarify that the 2 ambulances that were available when Joan Davis needed transport to Santa Rosa were not able to transport her because they were here for 911 calls. When the ambulance level gets down to 2, it starts at 4 because there's 4 ambulances. When it gets down to 2, those ambulances are only used for 911 calls. So at 5:15 when she was ready, or 5:45 when she was ready for transport, there were no ambulances. Between that and 11:11 when she was transported, an ambulance came into service, changed the status to 3, but before it was set up to transfer Joan Davis, it went out on a 911 call. I just wanted everybody to know that just because there's ambulances doesn't mean some of their services can be had. So, thank you.
Thank you. Okay, Andrew Hosford.
Can we let Paul go first?
Sure.
Okay.
Paul Hosford.
Good morning. My name's Paul Hosford. I'd like to ask if the Board of Supervisors could give us an update on the ad hoc committee research on the EMS situation in the county.
Let's see. Is there an update from the ad hoc for EMS?
Well, there's not one on the agenda today. Maybe I'll refer to County Council.
Mr. Chair, since it is an agendized item, I would keep any discussion pretty limited in terms of response to public comment. I would not go beyond what would otherwise be covered in a supervisor's report.
So if I may continue, I would say it's a crisis, and there's an argument that it's county responsibility. This county contributes very little to ambulance service. Historically, it has worked without contribution, but national policy trickling down, the reimbursement rates are so low that private ambulance companies cannot sustain. And there's been some discussion about trying to run a sales tax. And I know that hasn't been popular in the cities because the cities have limited funding channels, sales tax being one of their primary sources. We're approaching a ceiling. We don't know that it would pass without the support of cities. And so going forward, either the county will need to contribute, we'll have to find another creative solution to find funding. The city of Ukiah is currently undergoing a feasibility study. We expect to be done sometime in spring. They're looking at the entire county. That might shed some answers on just how much of a financial contribution will be required.
Okay, so does the chair have, do you have anything to update with how much further you're going to go with, or how soon, besides the spring, that the situation with the EMS?
Well, hopefully we will have a report this afternoon about the ad hoc committee and what they're doing, so what their progress they're making.
Okay.
So.
Okay. Thank you.
Okay, thank you. Okay, Andrew Hosford.
Good morning, everybody. Thank you for taking the time to listen to us. I haven't personally involved myself with county politics really ever. And I think that as many of you have experienced, there's something in your life that happens that calls you to action or calls you to try to represent that. And so that action was the death of my grandmother, which we don't know what would have happened, but potentially could have been altered if we had the appropriate services in our rural communities. And this has been an ongoing issue that more and more of our county, county constituents are concerned about, not necessarily in the more, I'm not going to say metropolitan, but more concentrated areas, but the rural communities, particularly up the 101 corridor. I appreciate Supervisor Williams' social media campaign regarding the updates of the services and the staffing levels updates that have occurred. done a fair amount of research on, what do these mean and how often are these things happening and how often are our services deficient that is resulting in delay in services for critical care or IFT, interfacility transports outside of our community. It seems like it's a significant amount. I asked somebody one of our first responders, how often do you think this is happening? He said probably about 50% of the time our services are insufficient enough to provide appropriate medical IFT, interfacility transport. And so what is resulting in that? What is affecting that? Some of the things are medical health and us not resolving that issue. Some of it is, Mendocino County doesn't have enough population to have a significant ambulance service come to the community because it doesn't pay. Our hospital that represents Ukiah and Willits and potentially may end up representing Fort Bragg, providing ER services, doesn't have an ambulance service. Fort Bragg does, but that's not going to result in the 101 corridor being covered. You can't require a private company to supply this service. I work at a company called Spare Time Supply. We distribute gardening products up and down the western United States. We provide transport as a service to our business because it benefits our customers. We give that away as a service even though we know we're losing money with it because it helps us in the long run and it gains rapport with our customers. I sure would like to see that with the hospitals, and I don't know if you guys could do anything to see that through. Thank you.
Thank you, Mr. Hosford. Okay, Scott Ward.
Good morning and Happy New Year. Scott Ward, River Valley. My comments aren't quite as serious as the ones with the ambulance. My family was affected with my granddaughter not being able to get transferred to Santa Rosa with lack of an ambulance, and she was in a critical condition near death. So it is a serious matter to my family as well.